Hello everyone, my name is Sai Kokanor and welcome to the 2023 First International KHA Homeopathy Study Group Conference. So thank you so much. This event will be going until 6 p.m. Indian Standard Time. Our sponsors are Kavita Holistic Approach, Kevin Friendly Foundation, R2C Innovations, and Livish. And after this event, we're going to have a meet and greet with family and friends, so we're looking forward to that. Now I'm going to pass it on to Kevin to talk about our panelists.
Hi, I'm Kevin, and today we have 6 amazing panelists joining us. First, we have Dr. Sweta, then Dr. Uma, Dr. Kavita, Dr. Fatima, Dr. Vimala, and Dr. Renuka. Thank you guys so much for coming, and first we will be starting with Dr. Sweta.
Hello everyone, myself Dr. Shweta Singh, KHA Chief Administrator, welcomes our respected speakers, Chairman and CEO Kavita Ma'am, and all the attendees to our first International KHA Homeopathic Study Group Conference. First, we will have Dr. Kavita Kokanor as our speaker. Let me introduce her to all of you. Dr. Kavita Kokanor graduated with a bachelor's degree in homeopathic medicine and surgery, BHMS, in 1995. Since then, she has been practicing homeopathy in her homeland, India. After moving to the United States in 1998, Dr. Kavita got nationally board certified by the Council for Homeopathic Certification, CHA, as Certified Classical Homeopath. She is a registered member of North American Society of Homeopaths as RS Home NA and Certified HP Supervisor in Homeoprophylaxis. She is the President and CEO of Kavita Holistic Approach and founder and director of KHA Homeopathy Study Group Pro Bono, leads and mentor 15 to 25 groups of doctors. Dr. Kavita served homeopathic community selflessly for over 25 years and was honored as a proud alumni of JSBS Homeopathic Medical College, Hyderabad, India, as her silver jubilee in January 2020. She received a prestigious North America Homeopathic Award, Martha I Community Service Award from National Center for Homeopathy, NCH, USA. She also received Best Entrepreneur Award in 2021 from respected Professor Dr. N. Lingaraju, Principal of JSBS Government Homeopathic Medical College, Hyderabad, India. She received Legendary Homeopath Award in 2022 from the Health Minister of Uttarakhand, India, at the first National Homeopathic Conference organized by Homeopure Research Institute and Cure. She was recognized and honored by TANA, Telugu Association of North America, at Ladies' Night Out on October 2022, Michigan, for humanitarian services. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, that is North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA, Telugu Association, Executive Committee on Mother's Day at Michigan, USA, with DTA Community Service Award 2023. Dr. Kavita is a passionate, phenomenal leader, humanitarian, empowers women, a great motivator, works on self-improvement and personality development. She is the author of book Beyond the Limits, A Challenge to Prove Oneself, and A Dose of Spirituality with Kavita. Over 350 plus recordings on professional webinars, health, wellness, related topics, spiritual, devotional, and inspirational talks available on her YouTube channel, Kavita Kokanor. For more, visit her website www.kavitakhomeopathy.com and www.beyondthelimitskokanor.com. So please welcome our first speaker, Dr. Kavita Kokanor, with a huge round of applause. Thank you.
Thank you so much, Dr. Sweta. And first, I thank Universe for giving us this great opportunity to have this scientific session today. And thank you all for making it in short notice and we made our first international car study group conference in 5 days. So big round of applause to all the speakers who are here today. Speak about the homeopathic healing with realm of imponderables. And we have a disclaimer that all the information which is provided here is for the educational purposes only and should not be misused, and it is the audience interest and their listeners' choice. And actually this just recently we had Joint American Homeopathic Conference and have presented imponderables about color and sound remedies. It's a 1 hour session, but today I am going to speak about the highlights of this one. Basically, imponderables are which cannot be explained precisely. So, and today I'll be telling about the color and sound remedies, my experience and some innovative thoughts and application of color and sound remedies with short case examples around 11, but they are very short, and about the potency and precautions and the miasmatic state and homeopathic remedies and the diet for chakras that are associated with the color and sound remedies. First, I would salute to Dr. Samuel Hahnemann, founder of homeopathy. And homeopathy is divine art of healing. And with spiritual realm, this color and sound remedies which are stimulated at the chakra level. And whatever we are doing is just a dropping version, as Mother Teresa's quote. We know too well what we are doing is just a drop, but without the drop the ocean would be empty. And I would say the organon of medicine, the first aphorism, the physician's high and only mission is to restore the sick to health, to cure as it is termed. And coming to the Ambika Waters is the founder of Color and Sound Remedy. She is my dear friend. In 2008, we were discussing an autistic child case and she said, did you try color and sound remedies? Then I said, I am not aware of them, and that's how I got introduced to them. I learned her courses, and since then for past 10 years I am using these color and sound remedies. And she started them in 1990. She developed those remedies. She is the founder of Life Energy Medicine. There are 10 color remedies: red, orange, yellow, green, pink, turquoise, indigo blue, violet, spectrum and magenta. And we know India is full of colors, festival of colors, Holi. And coming to the preparation of the color and sound remedies, it is just like the homeopathic remedies, even the preparation and application. And Ambika Waters prepared color remedies in the Lake District in the far north of England with celluloid color filters used in the theatrical gels, and they are placed over the pure water in the glass tumbler into a mirror tray. And the sound remedies were made in the mountains of New Mexico using the tuning forks in the vibration of the musical notes that go into the pure water in the crystal ball. And color remedies work on the energetic or etheric body that holds the each chakra. And sound remedies address the mental level or the astral body. They stimulate the physical organs and the ductless glands. And these chakras are the receptors of the life energy that flows into the cells and bodies of all over body. They stimulate the physical organs and ductless glands. And as Albert Einstein said, everything is energy. So they work at the quintessimal energetic vibration of each chakra and help to release the stagnant energy. Coming to the color red, which is the root chakra. Say for example, like people who have issues with survival issues, they are not grounded, adaptability issues, and like adrenal gland, fight and flight hormone, they are all come under the root chakra if it is affected. And the sound note is middle C. So people who lack the trust in life, they are impatient, and as James Kent said, order in the economy. So in such conditions we can think of red color. I will come to about the potency little bit later. And the element here is the earth. And the color orange, which is at the affects the sacral chakra, Swadhisthana, and the musical note is sound deep. And the organs which are affected are the endocrine glands, ovaries, testes, and the lower part. Here the self-love, creativity is affected, and people who hold on to the grudges, that is where the sacral chakra. So they lack that one. Gratitude, forgiveness, and freedom of unconditional love is the main thing for this orange. And during the proving, people who have taken this orange, they love to wear the orange color. They have that pleasure. This is the chakra that holds the pleasure. And when Ambika Waters was doing the proving, all the people who have taken the sound D, they are all very happy, joyful, and they all have taken the orange color foods. And it all affects the mind, like aversions and desires. So coming to the color yellow, which is at the solar plexus, Manipura, and which is about the navel, the musical note is sound E. And the organs which are affected are the endocrine gland, liver, gallbladder, and they have the digestive disorders. People who lack this solar plexus, that stagnation, they have this self-worth issues, lack of confidence, and freedom of choice. So, and the element here is the fire. Coming to green color, which is the heart chakra, Anahata, which is at the middle of the chest, and the sound note is F. Means basically thymus gland, heart, lungs are affected, and it is very good for diuretic heart patients. And people who suffer with insomnia, fatigue, they feel who are depressed, loneliness, this remedy will give peace and tranquility. I am going to share few cases soon, and the element here is air. Next color pink, which is again the heart chakra, but there is no node, and the thymus gland. Here the motherly love, feelings of love are weakened when this chakra is affected, and it helps for the milk production and relieves the stress. The element here is the pink. And next one is turquoise, which is at the throat chakra, Vishuddha chakra or the cervical center, and the musical note is sound deep. Again the organs are thyroid, parathyroid, and neck, throat. And people who are autistic, hyperactivity, it really helps them in to be calm, focus, concentration, and the willpower, the trust. The element here is the ether. Next color indigo blue, the third eye chakra or the brow chakra, and the musical note is sound A. Basically anterior and posterior pituitary glands are affected, and it is like connecting oneself to the higher, and the element here is the cosmos. Next color violet, which is at the crown chakra, Sahasrara, the top of the head. The musical note is sound B, and the pineal gland secretions, nervous system, and this is again the beauty of life and connecting oneself to higher self. The element is pure bliss. And we have the spectrum or the chord, which is the color of all the colors and all the musical notes. Spectrum, all colors and the musical notes, especially for those people who are burnt out, exhausted and undergoing severe major illness, this chakra will help. And so miasmatic state coming, root chakra is the soaring, sacral chakra psychotic, and solar plexus syphilitic, heart chakra tubercular, throat chakra acute miasm, brow chakra it has all the miasms, and the crown chakra there are no miasms involved. And basically all the our emotional diseases coming to the, as mentioned in the aphorism 224, 225, 226, there are several aphorisms which deal with the emotional disturbances, interpersonal relationships, and the exciting cause, acute cause. All this matters in when we are curing the patient and the client. Coming to the cases. So let me share 11 small short cases like asthma, PCOS. So let me share case of varicose veins. Female 49 years and she is anemic, constipated, engorged veins, has suicidal thoughts, guilty, depressed and not connected. And her constitutional remedy was aurum metallicum, and along with supplement red 12C daily, it was given for 1 month. And her mood and circulation got improved and varicose veins got better. But be careful when you are giving red to people who are above 50, as it might cause some disturbance, and it should not be given during the daytime as it is a hot color remedy. And homeopathic remedies for root chakra, sorinum, sulfur, aurum metallicum, semicifuga, colophyllum, and I'm just telling few remedies. Okay, let us go with the diet for the root chakra. Anything that are red color. Red apples, beetroot, tomatoes, pomegranate and raspberries are all good which stimulate the root chakra. Now let us have some affirmations to stimulate the root chakra. I am thankful for all the opportunities and growth and development that come my way. I stand for justice, truth and love. Now, let me share a case of PCOS. Women aged 40 years suffering with PCOS symptoms, and for the past 2 years with irregular menses, mood changes, abnormal weight and all the symptoms like was full moon. Repetization was done and the remedy that was selected for her constitutional remedy was Calcarea car, and along with it orange 12C was given for 1 month and followed by the 30C weekly, and it helped to regulate her menstrual cycle. Now let me share case of depression. Female 38 years old, depressed. She holds on to the grief, likes salt more, and her constitutional remedy was natramur. Along with that, she was also given 12C in the morning daily for 1 month, followed by 30C. And within 2 months, she became more joyful and enjoying her life. Let me tell a case of infertility. Female with 32 years old, unable to conceive, but loves to have a baby, overwhelming, very depressed, and she wants to decide to travel. The one thing is like she likes to make circles, anything she takes, and sometimes she uses the F words, and she has the feeling of being trapped. Salmon 200C was given along with orange 12C, and after a couple of months she was able to conceive and blessed with a baby boy. So homeopathic remedies for addressing the sacral chakra, medorinum, folliculinum, aconite, gelsemium and many more. Diet for the sacral chakra. Orange color foods, carrots, mangoes, any peaches are very good, which are rich in omega fatty acids. Affirmations for sacral chakra. I honor my body and treat myself respectfully. I trust my feelings and give them ample room for expression. I am grateful for the joy of being me. Let me share a case of ADD, 17-year student and not able to concentrate, lack of confidence and depressed. So, lycopodium was given and also yellow 12C was given daily and sound E6X alternated with sound E. And within 1 month, he was more happy and concentration improved. So along with this, the Gnana Mudra of knowledge will also help him to focus. Remedies for solar plexus is carcinosin, aconite, chelidonium, lycopodium. And the diet for solar plexus to stimulate yellow color foods, bananas, pineapple, lemons, corn. And affirmations for the solar plexus is I know my worth, honor who I am. I am confident that my path in life will open and heal me. Let me tell a case of asthma. Boy 6 years old, he has difficult respiration and cannot lie down at night, very sensitive, he cries easily, more at night and chilly and exposed to cold gets sick. He loves sausage and his right nostril is blocked more than the left. And his constitutional remedy after repetitization was silesia. He was given 12C and sound F 6X daily. And within 2 weeks he got improved and has good sleep, his immunity increased and less asthmatic attacks. Homeopathic remedies for heart chakra, cactus, crataegus, digitalis, china, lachesis. Diet for heart chakra. Balance your heart with greens, raw foods, kale, broccoli, spinach, chard, and affirmations for the heart chakra. All good resides within my heart. I look for joy in myself and I see in all things. Okay, let me tell you about a case of eczema. Boy 12 years having dry eczema, intense itching, very irritable, has headache in the evening and night, desires speech and constipated. After repetitization, his remedy, constitutional remedy was lycopodium. And he was given pink remedy 12C daily. And the beauty of the color and sound remedies is you can apply them, mix with any solutions and apply over the face or anywhere as a moisturizer, and it also heals. And he got better with his eczema. And case of autism. Boy 6 years old suffering with autistic spectrum disorder. And he has speech therapy. Turquoise 12C was given along with his constitutional remedy and sound G. And he received it over 1 year and gradually improved. And the homeopathic remedies for throat chakra, tuberculinum, ignitia, iris versicolor, staph aureus. Diet for throat chakra. Blue color foods like blackberries, herbal tea, raw honey are very helpful. Affirmations. I live in truth. I communicate truth and I am truth. Okay, let me tell about a case of insomnia. 52 years old, very ambitious, restless, has difficulty falling asleep. And his constitutional remedy was Nux vomica. And he received indigo blue and violet and pink. So you can mix up to 3 combinations. Either 2 color remedies and 1 sound remedy or 2 sound remedies and 1 color remedy. So up to 3 combinations it is it is good. And he made very good improvement. And diet for the bro chakra, think of all purple color foods, purple grapes, blueberries. Okay, and homeopathic remedies for the bro chakra, anterior pituitary and posterior pituitary. Affirmations. I honor my mind. I respect my intuition. I think the best of myself in all situations. Case of migraine. Male 22 years old suffering with intense throbbing headache, very nervous, restless, and worse from motion and light. Along with the constitutional remedy, he was given violet 12C and sound B6X daily, and within 2 weeks his migraines got better. Diet for the crown chakra are focus more on fasting. Detoxifying can help the body to heal, and lavender and sage also helps. Affirmations for the crown chakra. God is in me, above me, below me, and around me at all times on my side. Let me tell one last case, a chronic fatigue syndrome. 45 years old female has muscular pains, no motivation, totally exhausted, no hope to live, very depressed. Spectrum 30C and cord were given daily, and within 10 days, her mood got improved. So, I know I am going too fast because lack of time, and I am almost there done. So, the precautions and contraindications are hot colors should be given in the morning, like red and orange, because it will disturb the sleep, and the blue yellow in the afternoon, pink violet in the night. And red color should not be given when there is high blood pressure and violent anger. Orange should not be given when they have the strong temper and hyperactivity. And if you see the potency, like 6X, 12C, 30C are good, and they can be given daily, weekly and monthly ones. And see, for these chakras you need, when we are stimulating them, we need the meditation and the mudras that help in the flow of the energy, and that can be located on the hand. So I think I would end this one, but for the detailed thing which I have mentioned, there is we will be playing. And thank you so much. If you have any questions, we will answer it then. And you can also email us at caststudygroup@gmail.com. Welcome our second speaker, Dr. Sweta Singh, our CAR Chief Administrator. She is a Senior Research Fellow in Central Council for Research in Homeopathy, Headquarters, New Delhi. She is highly qualified homeopath who has been a core member of Orbit Clinics since 2014. She is the branch head of Orbit Clinics, and she brings with her a rich experience of more than 10 years and expertise in treating many difficult cases. She is also working as a medical director of Muskan Foundation in the field of drug de-addiction. Dr. Sweta graduated in BHMS from Baskin Homeopathy Medical College, completed her MD in Homeopathy, and she also completed a postgraduate diploma in health promotion from National Institute of Health and Family Welfare, New Delhi. Currently, she is pursuing PhD in homeopathy from a reputed university. Dr. Sweta wore the crown of President of Delhi Homeopathic Medical Association in December 2021 and became the first female president of this association, which was founded in 1932 by Dr. Yudhvir Singh, Health Minister. Dr. Sweta is our CAR Chief Administrator, and she is the Chief Editor of biannual newsletter Exploring Homeopathy. She is Executive Director of the Hanuman Homeopathic Sandesh. She worked at the post of Assistant Professor in the Department of Organ of Medicine and Homeopathic Philosophy. She is the recipient of many awards. To name few, recently received Legendary Homeopath Award from the Health Minister of Uttarakhand, Shri Dan Singh Rawat on 21st August 2022 in the first National Homeopathic Conference, and Homeo Icon Award 2019 from Board of Homeopathic System of Medicine, Delhi in 264th birth anniversary. She is a recipient of Ka Hanuman Best Performance and Ka Outstanding Award, and we welcome Dr. Sweta Singh to continue with her speech.
First of all, today I'll start by remembering Dr. Samuel Hahnemann on his death anniversary, 2nd July 1843. He left us, and but the homeopathy, the principle of homeopathy is in our heart, alive today. And now I'll start my topic, deciphering the true realm of homeopathy. So basically, homeopathy, it is based on law of similia, similibus curantur, which means likes, cures by likes. So the basic principle is similia, so we choose similar remedies to treat similar kind of symptoms which are appearing in the patients. It is based on individualization. Homeopathy is different from the modern medicine. How? Because they choose medicines by the name of disease, but in our pathy, we choose medicine with the symptoms which our patient is presenting to us. Like the selection of remedy is based on individualization. So what is individualization? It is basically the process of differentiating one patient to another from another by some set of symptoms, by some exclusive features which can be found hidden in the patient history. So we take a lot of history in our patient in our clinics. Why? Our patient generally asks why such weird, unique and surprising symptoms you are asking. Why? Because we have to individualize our patient from one person to another who is suffering from the same diseases, but they are presenting some different symptoms, like they are differentiating themselves in physical generals or mental generals or some emotional symptoms. So we have to differentiate our symptoms to choose our remedies, one remedy for one person. In aphorism 82, Dr. Hahnemann says, no real cure can take place without a strict particular treatment of each case of disease. It didn't mean that we have to select particular treatment for a disease, but in homeopathy for an individual. Cure. What is cure? In modern medicine, disappearance of symptoms is called cure, but in homeopathy, the cure is much deeper meaning. It is not only the disappearance of symptoms, but there is healing at various levels. At the physical level, at the mental, spiritual, emotional level. So our patient is recovering or restoring health at all the aspects. This is called cure in homeopathy. Next. In search for a homeopathic specific remedy. Homeopathy, basically, we don't have specific remedies with the name of diseases, but we have specific remedies for individuals according to the symptoms they are presenting. So the more striking, singular, uncommon and peculiar characteristic signs and symptoms of the case of disease are chiefly and more solely to be kept in view. We have to individualize our patient with such symptoms which are more striking, which are uncommon, characteristic in a case to form totality of the symptoms. Every case has these symptoms which are hidden. We have to search it out in order to prescribe a remedy, the most similar remedy to a case which can cure their diseases. The cyst is how we will differentiate, we will see through my cases. Like ovarian cyst is there, but it is left-sided. So one differentiating symptom is left-sided ovarian cyst. So it is simple. Usually we homeopaths complicate a case, but the patient is giving us in simple language, very simple, simply you can simplify the case in small clues. So the first symptom which is differentiating this case from other ovarian cyst cases is left-sided ovarian cyst. Then the presenting complaints were left iliac and hypogastric regions since 3 months. Aggravation was during menses. More the pain is when the flow starts. There were early profuse prolonged menses which is common in ovarian cyst cases since 2 to 3 months. There was wide discharge per vagina, thick, wide and little offensive. Next. The associated complaints with the same complaint is constipation. There is bleeding per rectum which is occasional, on and off bleeding, which is bright red in color with pain during and after stool. There were pain and heaviness in legs. The patient was very sensitive. When you touch her legs, she'll just start crying. She feels that pain so much. So there is brittleness in the legs. Fragility feeling. There were muscle cramps which were especially at night. And next, an aggravation by touch. The desire was for tea. She has a lot of craving for tea, 7 to 8 cups per day, though it causes flatulence. It is causing complaints to her, but she is taking tea. She is habitual to it. She craves for it. She can't resist the craving. So the symptom is desire for tea, right? Stool is constipated. There is history of piles, painful stool on and off. Sometimes the pain is much, the stool recedes back. Perspiration was more over genitals, which is slightly stridous. And thermals was the patient was chilly. On the mental generals, when we asked the temperament of the patient was very irritable, but with the family members, not with everybody, but she is more irritable towards her family members because when she got married, the in-laws or the husband was very rude to her. So that behavior hurt her and she became she developed that aversion towards her family members and she became irritable towards them. She fights with her husband and in-law, she is quarrelsome. Every contradiction aggravates. There were dreams of falling. There were jerks in sleep as if she fell down from height of dead people. Can anybody suggest the remedy? So the totality of the symptoms. What is the totality? This is the entire representation of the disease. This is not quantitative collection of symptoms, but it is qualitative. It should be qualitative so that it can suggest you the most similar remedy. And here the symptoms are left-sided hemorrhagic ovarian cyst. We have her USG in which the hemorrhagic cyst was 35 mm. Then the pain left ovary which aggravates during menses. Pain aggravate with the flow. There was desire for tea. Dreams of falling from high places or dead people. There was sweat on neck and genitalia which smells sweet and brittleness of bones. Anybody with the totality? So we need a left-sided remedy which can act over the ovaries, glands, especially ovaries. There should be desire for tea. Clark says there is people with aggravation after vaccination and tea drinkers. Yeah, you're right now. So next, this is the USG findings, and in the first USG you can see there was hemorrhagic cyst of 35 mm and we gave Thuja 200 one dose followed by Rubram Med 30 TDS, and in the 3 months The hemorrhagic cyst disappeared with a single dose of Thuja 200. That is the beauty of homeopathy. With the simple clues which are hidden in our patients. So the next case. So Thuja 200, single dose. Next. This is the revitalization chart, and Thuja was the first grade remedy in that case. So this is a case of wart over the breast. A female patient who is a housewife, aged 30 years, about 5 feet 5 inches tall, weighing, she's obese, came to me with an outgrowth on her left breast. Next. The location was on simply looking at the presentation. You can see the location was left breast near on the areola. Description: wart-like growth. There is fluid filled in that growth, pea-sized, hanging with a stalk. So it is pedunculated. You can see in the presentation this wart over the areola, left-sided breast, and it is fluid filled, attached with a stalk, pedunculated. Next. It was painful, and on our repertorization, I took up the symptoms like large wart, where causticum, rustox, sepia, silicia was there, pedunculated wart, these are the medicines, painful wart, and soft. So these were the medicines which are coming up. But on asking, these are the common symptoms, but on asking her the mental journals, we got the symptom that the patient was very much anxious about her health. Basically, before this she came up for this wart, she was visiting me so many times, saying, "Doctor, there is something in my breast. There is some lump. Can you please check?" She was visiting me since, before that wart for the last 1 to 2 years. She's keep coming on me and saying, "Doctor, please check, there is some lump. Is there any lump in my breast? Please write down some mammography or some USG so that she can calm down." But there was nothing at that time. But one day she came to me with this wart. So on that history, because she's keep coming on me, she was my patient since so many years. So I took up the symptom. She was markedly anxious about her health. She was keep coming for her breast examination, and the same presentation was coming on her breast. That was strange, But she even want the mammography, which was found normal. But the anxiety remains the same in that case. Next. So I took up this symptom, anxiety, health about Argentum italicum calcarea. There is one medicine missing, that is nitric acid. So in the previous repertorization chart, you will see nitric acid is also coming in those rubrics. And in anxiety, health about, this is a single remedy which is coming up. So I gave acid nitricum 30C, and you can see the result. In 15 days, in the second day 3, the wart is dried up. In the third, it hangs down, totally dried, and on the 15th day, it disappeared with acid nitricum 30. Next. This is a case of endometrial polyp. So a female aged 27 years come to me with irregular vaginal bleeding, with weakness and trembling of legs. She is fair in complexion, blue circles around the eyes, and the presenting complaints were intermenstrual vaginal spotting since 5 to 6 days, which is aggravated during urination. And she also complained of trembling and very much weakness with loss of appetite and all. Next. So the patient was apparently healthy, since 5 to 6 days. Then she started complaining of this. When she visited me, she looks very depressed and sad, like she about to weep. On further inquiry, it was found that there were some family disputes, in her family with her brother and sister-in-law. And at that time, her mother or the brother didn't support her. They take the side of her sister-in-law. So she became very silent, irritable. Anger is quite visible on her face, but it is suppressed. She didn't say anything to anyone. She is silent. Otherwise, before that incident happened, she was sincere, happy girl, but she is sensitive and emotional too. Next. So this is her LMP, and in the past history, she has acne, which she has undergone homeopathic treatment. Next. Appetite was decreased because of that incident that happened. Thirstless, she was thirstless, desire for salty things, hot patient. Next. She's irritable, jealous of her sister-in-law because of that dispute. Contradiction aggravates her. She's angry, weeps when alone, fastidious. Next. With those symptoms which are coming up because of that sadness, suppressed emotions, and all, I repertorized the case, and natramuse was coming, so I gave natramuse 200. She was hypotensive also, and there was 11 mm endometrial polyp which was seen in her USG report, and the endometrial lining was also thickened and heterogeneous in nature at that time. So after that natramuse 200, there was no intermenstrual bleeding. Patient feels better. Menses were on time but were profuse, and there is appearance of pustular eruptions on her genitals, which was a previous symptom. So old symptom is like we are going in a right direction. Mentally, she is feeling better. So I prescribed Seclac. Next. In December, this was a case, the report was done in September 2020, and in December 2020 we again do a ultrasound report, and it shows there is increase in the size of endometrial polyp after natramuse, I guess 200, and there is increase in the size. So, but there was a difference. Like previously, the endometrial lining was heterogeneous in nature and thickened. But this time, after natramuse 1M, the endometrial lining is homogeneous. So there is increase in the size of endometrial polyp, but the endometrial lining is changed to homogeneous nature and it is normal. So next. In January 2021, there was no intermenstrual bleeding because the size was increased, and there was one more thing that strikes to me, that is the indifference of that patient to her mother, because mother and the brother whom she loved so much before that incident happened. So that incident took me towards sepia, because natramuse sepia is the complementary remedy to natramuse, so I chose at the time sepia 1M. After that, we go for USG, and it was cleared. There was no endometrial polyp after sepia 1M. Next. This is the last case I want to show. This is a case of 2-month-old baby. My maid came with her, and you can see the condition of her skin. Atopic dermatitis. You can see the condition, the hair are glued up, there is sticky discharge, pustular discharge on the skin. Next. On the presentation, one remedy clicked to my mind just after seeing the baby in that condition. With these symptoms, moist skin eruptions, copious serous exudation, thick leather-like crust under which chicken white pus collects here and there. Hair is glued and matted together, offensive. Eruptions after vaccination. The remedy is Mesothelium. Next, and you can see the result with Mesothelium 30. So the baby recovered so wonderfully after this meserium doses. So this is from my side. Thank you so much. Our next speaker I want to introduce is Dr. G. Umarani, Associate Professor, Jim's Homeopathic Medical College and Hospital. She is MD in Repertory with additional degree of MSc Medicine Anatomy. She has professional experience of 12 years, 5 months in anatomy, and she is BHMS from GSPS Government Homeopathic Medical College and Hospital, MSc from Southern Institute of Medical Science and Hospital. She received honor from Elders Club International Hyderabad, where they Seva Ratna Award, felicitated on 25th December 2022. She has participated as a resource person to panel discussion on topic Homeopathy, a woman best friend, conducted by Homeopathic Medical Association of Telangana on 22nd March 2022. She has been a speaker in CA webinar on homeopathy in menstrual disorders in 2021 and received Best Performance Appreciation Award in 2016 at Jim's Homeopathic Medical College and Hospital, and is an author of various research articles in many prestigious journals. So welcome Dr. G. Umarani. Please.
Thank you so much, Dr. Shweta. The most powerful, amazing and incredible thing of a female body can do is grow a life inside of it. Pregnancy is a special time for a woman and her family. It is a time for many changes in pregnant woman's body. The emotions, fatigue, difficulty to find a comfortable position to sleep, but just knowing the body is growing inside of her is one of the most rewarding experience of a woman can enjoy. So, the troublesome effects of many conventional medications indicated during pregnancy have promoted some women to turn the homeopathy as a safe and effective treatment option for pregnancy related symptoms. Hence, a very good evening to one and all. Myself, Dr. Umarani, Associate Professor in Jim's Homeopathic Medical College, stand in front of you to speak on topic Homeopathy in Antenatal Care. If you define that antenatal care, it is a systematic supervision of a woman during pregnancy. It is called antenatal care. So what is the aim, objectives of antenatal care? To screen the high risk cases, to prevent or to detect and treat the earliest any complications, and to ensure continued risk assessment and to provide ongoing pregnancy preventive health care, and to educate the mother about the physiology of pregnancy and labor, and to motivate the couple about the need of family planning. So the main objective of this is to ensure a normal pregnancy with a delivery of a healthy baby from a healthy mother. So what homeopathy can do in pregnant women? Homeopathic medicine does not cause side effects because only a minute amount of ingredients used in their preparation. They work by stimulating the body's healing power. The fetus is genetically diseased or received some hereditary dyscrasia from its parents. It can be removed by constitutional anti-miasmatic treatment of the mother during pregnancy. So, the best procedure to treat such cases is to treat their parents' constitutional disturbances before they are expecting to have a child. So, what is constitutional homeopathic treatment can expect before they want to conceive? So, if a person is having fear, anxiety, restlessness and functional ailments and history of threatened abortions, then they come under as a SORA constitutional, that is carbonitrogenide constitutional. Then can be given as a anti-soric constitutional remedy. And a person who suffers from gonorrheal infections, malpositions, malpresentations, they comes under the psychotic miasm. They are hydrogenoid constitution. And persons of destructive changes, abnormal pregnancies, habitual abortions, then they come as a syphilitic miasm. They are comes under oxygenoid constitution. So if you see that miasmatic approach in the homeopathy about the pregnancy and prenatal, nosodes can do work, but it should be used when it becomes the similimum only. So many of the physicians can use routinely some nosodes like a series, but can have that it should be a similimum. The root use of the sorinum, medorinum and syphilinum in general frowned upon, because it is a similimum that patient needs, not that routine one. So example, if you see that a child born with the syphilitic skin vesicles, they might give syphilinum rather than the similimum. So it should be avoided. So coming from that prophylaxis, Hahnemann itself told in the 284 aphorism, Organon of Medicine. So he told that it is advisable to give a mother sulfur 32 globules and allow him to act for 2 weeks, after which a dose of calcarea carb is allowed to act for 6 weeks. It will be applicable all cases and has the effect of purifying the fetus from soric trait. So it is, if that person is having the history of skin diseases in parents, then 2 doses of sulfur 200 at the interval of 2 months, and after the same interval 1 dose of 1 potency to be given to the mother. Then if mother is having venereal train, to 2 doses of Mexal 200 and 1 dose of 10 will be indicated. So to avoid the syphilitic effect of the child, then syphilinum 30 every 15 days and Mexal 6 daily in the morning throughout the pregnancy until the child sucks the mother's breast. So this is the constitutionally prophylaxis miasmatic approach of a antenatal woman. Now this approach will start before that pregnancy, that is prenatal care. So what is the objective of prenatal care? So care for the mother and the baby should begin as soon as pregnancy is planned or confirmed. For this, to deliver a healthy infant and to maintain a health of the mother, and should see that woman enters pregnancy with an optimal state of health. So this is that objective. And what is the role of nutrients and supplements before and after conceive? So folic acid should give, and 400 mcg of folic acid each day, beginning 1 month before becoming pregnant, and through the first 3 months of pregnancy is recommended, and 600 mcg of folic acid each day during pregnancy is recommended. So with this folic acid, it only works to prevent neural tube defects before and during the first few weeks of pregnancy. And what is the role for that homeopathy in nutrients? So we can give calcarea phos, ferrum phos, ferrum metallicum as its nutrient supplements. Then here I will give few antenatal problems of a woman, common problems where commonly affected and where the homeopathy scope. So I usually give that some cases, so those only I have quoted here. So first and foremost, very important, anemia during pregnancy. So pregnancy anemia is one of the important public health problems, not only in India but also in most of the Southeast Asian countries. So about 16% of maternal deaths are due to anemia. So it is also increases the maternal morbidity, fetal and neonatal mortality and morbidity significantly. So according to the classification of WHO, The pregnant women with hemoglobin levels less than 11 grams in the first and third trimesters and less than 10.5 grams in the second trimester are considered anemic. So how will you prevent? A quality antenatal care can prevent nutritional anemia. So before pregnancy, the diet must supply sufficient amounts of right kind of foods to enable the mother to begin her pregnancy with sufficient store of nutrition. So food containing iron like animal protein and vegetable, spinach and fruits are to be given. What is the scope in homeopathy in the iron deficiency anemia? So we can give the remedies like Altris ferinosa, and we have marked anemia due to nutritional disturbances, and tired, dull, heavy and confused, then we can think of this remedy. Then Cinchona officinalis, so when there is a gland progressive anemia associated with flatulence, can we think of the Cinchona. Calicar, one more remedy. Anemia due to loss of fluids, edema of upper eyelids, rapid and weak pulse, can think of Calicar. Pulsatilla is one more remedy where indicated after abused or overuse of iron tonics. Then we can think also Natramur for this iron deficiency anemia, where the headaches which are increased from sunrise to sunset, with the pale face, nausea, vomiting, and dyspnea while ascending stairs are from physical exertion. Then one more very important, ferrum phos frequently can give for this iron deficiency anemia. So where that anemia patients with violent local congestion. So it is very effective in increasing hemoglobin levels in the pregnant woman. So next is the very commonest complaint of a antenatal pregnant woman, that is nausea and vomiting. So where that nausea and vomiting are one of the earliest complaints of the pregnancy. 70% of expected mothers have symptoms of this sickness. Normally it occurs 6th week and passes off by 12 weeks. However, it can start as early as first menstrual period and may continue throughout the pregnancy. So it is very common in priming. And what could be the cause? Where that increased levels of HCG hormone, estrogen, progesterone in circulation, and hypoglycemia during early pregnancy is the commonest causes. In early pregnancy, nausea and vomiting, first check for the severity of the vomiting. If it is mild to moderate, then provide some conservative measures, give the reassurance and appropriate homeopathic treatment. If it is severe, look for the signs of dehydration, loss of skin elasticity, and refer to the obstetrician for correction of electrolyte imbalance by IV fluids. So next, toothache is pregnancy. So when that hormonal changes during pregnancy causes teeth and gums more susceptible to pain and infection. So the probable homeopathic remedies in the toothache in the pregnancy: magnesium carb, Ratania, Chamomilla, Staphylos aureus, Sepia, and Hecla lava. So this we can give routinely for that pregnant woman who are suffering with a toothache. And one more commonest problem where homeopathy only can treat that antenatal woman, that is tocophobia, that is anxiety and fears. This fear of pregnancy and fear of childbirth, it is a pathological fear of a pregnancy and can lead to avoidance of the childbirth. So it has to be treated. And what could be the manifestations? Change in emotions, change in behavior, and physical symptoms are like restlessness, nervousness, sleeplessness, crying episodes. These are the tocophobia. And commonly used homeopathic medicines like fear remedies, restless remedies like aconite, arsenic alb, simsifuga, ignitia, nux muscata, and pulsatilla. And the headache, one more complaint. It is during pregnancy, it is one of the most common discomforts and complaint. And the cause could be that increased levels of progesterone during pregnancy, along with increase in blood volume circulating throughout the body. And physical and emotional stress, lack of sleep, low blood sugar, dehydration, these are the causes of this headache. And general management of this headache is to avoid the stress and get plenty of the rest and relaxation. So that what are the probable homeopathic remedies? These are the belladonna, chamomilla, bryonia, simsifuga, gelsemium, spicelia, sepia can used to treat the headaches. Next is the commonest complaint, that is constipation and hemorrhoids for a pregnant woman. It is defined a delay or difficult in defecation that is present for 2 weeks or more. So the cause is increased levels of progesterone, which causes sluggish bowel peristalsis and which causes hardening of the stools and constipation. So compression of the even intestines, superior rectal veins by the gravida uterus in later part of the pregnancy, the common, and this is the commonest cause for this hemorrhoids piles. And these aggravating factors for them are poor intake of diet, fiber, poor fluid intake, intake of the oral iron, which can worsen the condition. Homeopathy management for this, that Asclepius hip, colinsonia, sepia, we have that nux vomica and that ammonium mure. So these are the probable remedies. The next is scope of homeopathy in miscarriages we have. So abortion is the expulsion or extraction from its mother of an embryo or fetus weighing 500 grams or less when it is not capable of independent survival. So the probable remedies for her, that is miscarriages in Sabina, Actia racemosa, Sickle, Helonius, Viburnum opulus, Crocus, Sepia. These are all indicated homeopathic remedies where there's some they are 3rd month, 5th month abortions and history of abortions also there. They can give these remedies with the similimum. Pregnancy in pruritic skin. Mostly these skin conditions resolve after delivery, but they require some symptomatic treatment during pregnancy. The remedies: caladium, thyroidinum, ambragracia, then creosote. So these are the probable common remedies used for this pruritic skin during pregnancy. The cough is commonest condition where the homeopathy scope is very good in this condition. It may occur due to sympathetic irritation of pneumogastric nerve in the earlier months of the pregnancy, irritation of the diaphragm from the upward displacement of organs in the later months. So in some cases even cough may occur due to other pathological conditions also like tuberculosis and asthma. The homeopathic management here in these cases, we have that calibrom, muscata, conium, causticum, sepia, phosphorus in different indicated complaints and indicated keynote symptoms can give wonderful results in the homeopathy. And the next backache, where most it is discomfort during pregnancy. Causes are hormonal changes which may cause softening of this ligament supporting that joints, lower lumbar spine, and increased mechanical demand and strain on low back imposed by the carrying fetus. These might be the causes for the backache. Then where that homeopathy management, we have that wonderful remedies like Asclepius hip, arnica, rustox. We have that indications of this keynote symptoms here, calica, ledum pal and sarsaparilla. So this sarsaparilla, ledum pal, if female is having that history of urinary complaints with backache, then we can think of to the treatment, and they need expert treatment and should be referred to that experts during this situation. So next is the commonest to that antenatal, there pedal edema. So edema is the abnormal and excessive build fluid in the body. So it is dependent edema occur due to impedance of the venous return. Usually we can see it in the feet, ankles because of the effect of the gravity. So pedal edema during pregnancy almost a universal feature and almost always goes away after delivery. But a pregnant woman present with slight degree of ankle edema which generally reduces after rest. We can give some advice general management to sit with feet elevated, lie on the left side with legs slightly elevated and wear supportive tights as stockings, use cold packs and swollen area and to avoid standing continuously for long duration, crossing legs while sitting, taking excesses of the salt, wearing high heels, these should be avoided. And we can start with appropriate homeopathic treatment for this pedal edema. We have remedies like epis, saposinum, acetic acid, ferrum metallicum, arsenic gall, and scope in malposition and malpresentations. Also we have scope homeopathy like therapeutic use of the pulsatilla 200. In some institutions like integrated where homeopathy and allopathy they will do, in some Kerala, Calcutta, in there they will use along with this allopathy they will use some medications like pulsatilla 200. Almost it is specific for malpresentation of the fetus when there is a transverse line. Under the observations of the obstetrician they will give these remedies. 2 doses, each dose at the interval of 1 week after 28 weeks. And even we can see in the repertory the rubric for this malpresentation, their delivery and parturition, delayed malposition. This is the rubric where we can find the sarsaparilla, pulsatilla remedies. And false labor pain. One condition frequently at the end of this month, end of that or middle of this antenatal, female can usually feel this pain. These are the contractions which occur at irregular and unpredictable intervals. And woman feels pain and discomfort in the abdomen, commonly seen in primi and then the multiparous. Pains usually appear prior to the onset of the true labor pains and 1 to 2 weeks before primi and few days before multiparous women. And to give the assurance patients and false labor pains we have like colophyllum, calicar and nux then pulsatilla and actia racimosa. These are the conditions. So at the end I want to tell about that homeopathy is safe for women to use during pregnancy, even postnatally, including during breastfeeding. It is gentle yet effective system of medicine and the remedies are highly diluted and are not chemical drugs. So they cannot harm the baby. So that's why I have taken this topic to tell about this. So most of the antenatal women can safely use that homeopathic remedies. Thank you. Thanks for listening. Next I would like to call next speaker Dr. Fatima Nisa Sheikh. She completed BHMS from Bharatiya Vidyapeetham Pune, postgraduated from SKHM Speed. She did MD in psychiatry. She has 25 years clinical experience in infertility, pediatric cases, chronic and acute cases. She also involved in camps on health awareness and she conducted national mental health seminar at Hamsa Homeopathic Medical College and she attended the predictive homeopathy camps. I warmly welcome Dr. Fatima.
Hello, good evening everybody. I'm Dr. Fatima Sheikh. I work as an assistant professor in Hamsa Medical College and I have been practicing since 25 years. So I would like to share you with clinical knowledge rather than going with the PPT. A brief description. Okay, I'm here to discuss about the scope of homeopathy in psychiatric cases. So nowadays, post-COVID, many people, you can see in and around you having few troubles related to their daily lifestyles. It could be their working place, they might be facing some stress, or in the family itself. We have seen lot of changes in everyone's life because COVID had almost put a full stop to all our lives. Okay, so I would want to carry on with that point as our friends, dear friends, Dr. Uma, Dr. Shwetal, Dr. Kavita, all have shared related to homeopathy. So I'll be going to a bit different area. So to our day-to-day lives, how we can improve to make our lives better. Okay, through homeopathy, I consider mind is the window to our body. If it is healthy, then only we can have a happy life. And what is health? The definition we read in books is physical, mental, social well-being. So if this has to be proper, that means our mind has to be in that state. It has to be happy. Okay, so the healthy mind is a healthy body and healthy soul. So that is the thing which I follow with my patients in my clinic. So I would want to share that experience with all of you. The basic thing is that you can see the highest and the most important level through which the human being functions is the mental level. So it is very much true. So when our mental levels or mental condition is healthy, we are very focused in our career life, with our family life, and success comes very easily to us. We don't have to struggle much. So coming to this, let me tell you, so homeopathy has even broadened its aspects in psychiatric cases, because I would want to tell you the difference between the other systems and our system. As already mentioned, we treat the patient as an individual rather than the condition or the disease. So we are more privileged as we are going to take the case in a very descriptive form, analytical, and also individual. So we know the person in and out, and it becomes easy for us to cure that case and that patient. We are not seeing him as a diseased or a condition, but as a patient as a whole. So we will always try to strike balance with the signs and symptoms, what he is facing, we are focusing on it. So that way we are giving more respect to his feelings, his emotions comparatively, okay? And we spend more time in the case taking, thereby allowing him to express all of his emotions step by step. Thereby it gives a lot of relief to the patient, because many times there are bottled up emotions in the body for everyone, for each of us. Even now there might be many people, some stress is there back of the mind, but we have to carry our day-to-day life. But this is the only opportunity at a homeopathic physician. You get that privilege that to spend open-mindedly whatever is there, you can express to him or her, thereby whatever the negative energy I feel. I do also believe in this chakras, what ma'am has mentioned earlier, Kavita. So I also have gone through the naturopathy, I have learned acupressure. So I feel that we should be going with nature. Our body has already made in such a way that whatever the circumstances are there, it has a thing to bounce back. We have gone through, many one of us go through a very good, bad, happiest, worst days, but we do bounce back. So that is the nature of the body. So obviously when we are going through some condition or any disease, it is a disruption in this phase. Okay, so we call it, our Dr. Samuel Hahnemann in 1788 itself noticed that they were very barbaric methods. The patients were tied. If he was told he had some mental condition, the treatment was very bad. So we should be very happy to know that our Dr. Samuel Hahnemann, founder of homeopathy, was a pioneer in separating and giving respect to the psychiatry department, like creating a separate system that we have to treat them also as other patients, give them the same respect and dignity, and take a proper case history. Signs and systems should be noted well and treated accordingly. So along with diet and exercise and few therapies which he also mentioned, has broadened back very simple cases like insomnia, depression, suicidal tendencies. We could actually treat them very peacefully. Why I am saying peacefully? Because we don't have to use any hard and core methods. Here we are simply taking the case history whereby 25% of the patient starts feeling better, and the rest is taken care of the constitutional remedies, which as homeopath we try to conclude after taking the whole case history, and through our consulting also we are able to uplift the mood of the patient, to go to the root cause of the patient, why that patient has gone into depression, or why he is thinking of a suicide, or what is the reason. So in homeopathy, we are not treating just the condition, we are going to the root cause. So thereby we are even trying to cure the patient completely. So we can give him the confidence to go back and live respectfully in the society, and also go back to his workplace just like normal. And this is a boon to us. I want to tell you again, to all of our homeopaths, this is a very boon and the right phase post-COVID, that we can literally grow like anything, because only our system is giving so much of patience and time to each and every patient to let out his emotions, his will, his desires, and everything is noted, which will be very helpful throughout his lifetime. I have patients who have thanked me after 20 years. They are again coming back and they are like, I was better 20 years back, and keep on reminding me that, see, I could do something best for her. She recommends her daughter, or she recommends some of her relatives. Means that is the impact we are able to leave to them. Okay, already we know that they must have gone to other systems, they must have taken the treatment. We all are aware of it, but we do have opportunity, and right now it is the best time, I feel. We are seeing a lot of improvement, awareness about homeopathy. Everyone is right now, after the COVID effect, during COVID effect, I could see online, many patients were inquiring what is the treatment, what line of treatment is there. After COVID, we are feeling depressed, we are not able to sleep, we are feeling anxiety, there is palpitations, we are not able to come out of our room also. The anxiety is so severe. Nak nidar patatle, very, very common. So I used to give Califos, and I saw 10 people coming next day for the sleeplessness. So this is what, I mean, it also encouraged many of them who were not believing in homeopathy. Let me tell you, who never believed in homeopathy also turned to homeopathy in COVID. So this is the wonder of our system. I hope that everyone uses means, I want to say, promotes it in an even better mode. Because I want, or you also as a physician, everyone's motto is that we want everyone to be healthy, right? And that too in a safe and most painless method and cherishable, I think. I think homeopath doctor is the one no one forgets, from children to old age. And even the elderly people, I think they come more frequently to me, sharing about their daughter-in-law, daughters, sons who are away and abroad. They're feeling so lonely. We have heard about emptiness syndrome, who are staying in states. They're feeling that empty because their children, their grandchildren are away. So they just come to us. The pains are actually because missing some loved one. So you don't want to give painkillers and make them suffer more. Yes, here the homeopath is there where we give some biochemics which won't have side effects and even relieve their pain, and we are giving some support. Okay, so we can say we are into family medicine, we are orthopedics, we are everything from gynecologist. So we can even treat the antenatal cases. Just now, as Uma mentioned, they also go through lot of mental condition, let us say, because of the changes occurring, they don't feel sleepy, or they might feel restless or tired, or that stress that about a new baby is going to come, how her life is going to change. She has to take care of the job, her house, her family, and her physical structure also. And in this generation, they are very conscious, not like us, that they don't want to lose out their physical appearance, they want to remain active. So here we can be a very good listeners to these people also, and we can take the cases, all antenatal cases can be done perfectly, safely treated by homeopathy. That is one thing I would like to say. We have the children, the best part. Last month I met recently one principal of some boarding school. So she came up, she was looking very lean. When I expressed what happened, she was like, I'm bothered about my children. I said, what happened? So she was like, they are in 10th. So what they experience 10th board exams means they are always very nervous, anxiety, lot of things keep on going through their brain. So whenever they come from home, they are depressed or something. We saw that some students try to attempt suicide. So I am feeling low because of that. So could you please conduct some survey, because we already tried psychiatry, counseling and everything. So we want, if there is an approach in homeopathy, what you can do. So we prepared a questionnaire, we did go to the school, we counseled. So the methodology was completely different. When we started asking them the questions, how they are feeling here, what is troubling them, why they want to go back home, or is there any problem in the hostel. So everything we were talking. So while communicating to the students, they felt very good. Whatever the problems they were facing, it was either related to food, or whether they were not understanding the syllabus or the approaching exams. When we started talking openly to them, and when we gave our remedies to them, after within 1 month we received calls saying that the students are feeling better, please come back for your second consultation. Okay, so I would want to say that please, all of you, there is scope in everywhere. Our system has scope in everywhere. Do it wholeheartedly. Do it from your heart and you will find the path. Okay, all the best. I don't want to share the PPT because I want you to do things from the heart. Right now, what I told, I know that you already know the remedies for anxiety, for schizophrenia, or for insomnia. All are well learned, but I would only request to all of you to please practice from your heart, give the best to all our patients and make them healthy. Okay, thank you very much for giving me this opportunity.
Next, we will invite our next speaker, Dr. Vimala, who is BHMS from JSPS Homeo Medical College, MSc Psychology, Tamil Nadu Open University, postgraduate certificate program in health promotion and counseling from IIHFW. She is associated with Social Welfare School, Vikarabad, from 1997 to 2008. She is associated with Anarachim, medical officer at Medak and Siddipet district. She is a regular medical officer at Siddipet, Nalgonda. So I am inviting her to give her session. Please welcome her with a huge round of applause. Dr. Vimla with us. Welcome, ma'am.
Hello everybody, I am Dr. Vimla. I am medical officer working in Nalgonda district. My topic today is hypothyroid and homeopathy. So about me, a small thing. I have done my BHMS from JSPS Homeo Medical College, and I have done my MSc Psychology from Tamil Nadu Open University. I have done my postgraduate certificate program for health promotion and counseling from Indian Institute of Family Welfare. And I have done a small program which is Vedic Nutrition, which is more important nowadays, from Unitas Academy. My professional experience is from 1997 to 2008. I have been working from AP Social Welfare School in Vikarabad and Rangareddy district. And from 2008 onwards, I have been working as a medical officer at Siddipet district and Medak. And 2009 till today, I am working as a medical officer in Siddipet and Nalgonda district. My clinic name is Sanjeeva Homeopathy, and our locations are in Masaptang, Medak, Karmangad, Aktapur and Siddipet. My topic for today is thyroid, a gland which is present in the neck, responsible for the two key hormones T3 and T4. T3 and T4 regulate metabolism, and it determines the speed which your body works. Hypothyroid, lesser thyroid hormone, slower metabolism, in long term leads to weight gain. Women in their 40s and 50s are more prone to than men. Main symptoms of hypothyroidism: weight gain, depression, mood swings, constipation, hair loss, hoarseness, fatigue, dry skin, puffiness of the face, menstrual irregularities, joint pains, muscle pains, elevated cholesterol, low heartbeat, sensitivity to cold and impaired memory. How the body makes thyroid is hypothalamus, which is situated in the base of the brain, which secretes TRH, that gives a signal to pituitary gland to produce TSH. Thyroid in return, taking TSH help, will secrete T4. Hypothalamus is a small walnut-sized gland at the base of the brain, and it regulates pH, hunger, thirst, oxygen levels. TRH full form is thyrotropin releasing hormone. Pituitary gland is the master gland of the body. TRH instructs pituitary gland to secrete thyroid stimulating hormone. Hypothyroid is a lifestyle disease which is of two types, type 1 and type 2. Type 1 can be fixed with diet and exercise. Type 2 needs medication along with diet and exercise. Type 1 hypothyroidism is a deficiency of iodine and iron in your diet. To fix your iodine deficiency, you can have seafood, seaweed, curd, strawberries and iodized salt. To fix your iron deficiency, you can have red meat, beans, dry fruits and peas. Iron and iodine help in production of T3 and T4. You have to avoid goitrogenic food like cabbage, cauliflower, mustard green, broccoli, turnip and soya. Affects function of thyroid gland. Type 2 is hypothyroidism, produces antibodies against thyroid gland. It is a genetic issue which runs in the family. Metabolism slows down and you will experience all the symptoms which were told by hypothyroidism. Affects virtually every organ and every tissue of the body. So it is important to have a holistic approach of the body. The main factor of hypothyroidism is stress. That is, pain can hurt, but stress will kill you. Hypothalamus secretes TRH. In return, pituitary gland will tell a signal to thyroid to secrete TSH. Thyroid gland will secrete T4. T4 will get converted in the liver to T3. T4 is inactive and T3 is an active hormone. If you have stress will give signal to hypothalamus to secrete more of TRH so that TSH is raised in the blood. Stress and liver. In liver, Stress interferes the liver conversion, inactive T4 to active T3. In that process, some T3 always ends up, which is useless, it is reverse T3. Range is between 0.5 and 1.8. We think we are going to hypothyroid, but no, it is functional hypothyroidism. The normal range is 0.5 to 5. More than 5 is hypothyroidism and less than 0. Will come into hyperthyroidism. If we take a range between 0.5 and 5, there is 3 phases, that is 1.8 and 3 is normal thyroidism, and if it is between 0.5 and 1, where the main range is between 0.7 to 1.2, which is you think it is going towards hyperthyroidism, but it is not. It is going towards the hypothyroidism. So you have to treat as a hypothyroid patient. Restore the thyroid function by reducing toxicity and autoimmunity. So immunity has to be increased to develop thyroid functioning normally. So poor conversion also because of the liver and gut and stress and inflammation. Plan of action: find a Ayush professional and low carb and high fat depending diet according to your metabolic health. Stress management: avoid tap water that is added with chlorine and fluorine. Strict diet plan has to be followed. Homeopathy comes here. According to Robin Murphy's repertory in the gland section, thyroid we have a first grade drugs, as all of you know well, and in children Berata carb and kali iode. Enlargement of thyroid also calcarea iode and spongia. Hypothyroid first grade drugs mainly calcarea iode, graphites, kali iode, natramid, sepia and spongia. I mainly focus on 3 drugs because I can't cover all the drugs which are there, but the main important 3 drugs which I want to tell is calcarea carb, mainly ailments from anger, vexation, anxiety, fright, headache causes, and anticipation, foreboding, bad news, business failure, worries, egoism, grief, obesity. Calcarea carb usually main sphere of action is endocrine gland, and the 4 F's are fair, fat, flabby, frizzy, catches cold easily. Late teens getting obese, hormonal irregularity, thyroid playing up, scanty and irregular periods. Calcarea puts the system in order. Natrum personality: they are always jealous, closed, pessimistic, vulnerable, past dwellers, insecurity, sensitivity, withdrawn and hatred. Natrum more as mental essence: over-consciousness, lack of interest, over-affectionate or no interest in people, fearful or closed, and fearless or open, not to hurt or not to be hurt, to hurt or not to be hurt. So mentally, clinically, depression, anxiety, premenstrual tension, anger episodes, not being well since grief, disappointment, cannot get over. The last drug which I want to tell is thyroidinum. The patient is always irritable, depressed, fearful, suspicious and grumbler. Hormonal imbalance during the changes of life, puberty, pregnancy and menopause, resulting in altered growth, developments and various maladjustments with temporal incoordination. Here comes the nutrition. Selenium, which calms down the body, protects and activates the cells of thyroid gland. Rich source of selenium are leafy green vegetables, nuts, seasonal fruits, berries, colored vegetables, broccoli, fish and kale. Necessarily includes zinc, iron, vitamin A rich food, beta carotene, omega-3 fatty acid, pumpkin seed, flax seeds in diet. Avoid raw vegetables, salads, excessive salt, sugar, saturated fats. Wheat and rice have to be avoided. Hypothyroid patients should not eat fermented food. Wheat, rice are not good. Can use rye flour, which is gluten free. Other olive oils, nuts, spinach, apple, avocado, chia seeds, pumpkin seeds, all these are rich in zinc, iodine, cheese, milk and egg, fish. Blanching the food reduces goitrogenic agents, hence raw food should not be taken when you are hypothyroid. LPL means live food has to be taken, plant-based food is important, low glycemic index food is good. Coriander seeds activates the thyroid cells, hence recommended to use coriander in the early morning, empty stomach. You can soak the 1 teaspoon coriander in water whole night and take it in the morning, empty stomach. Avoid 3S, they are salt, sugar and saturated fatty acids. Thank you very much.
Next, I would like to call next speaker, Dr. Katta Renuka. She did BHMS in 1995 from JSPS Homeopathic Medical College. Postgraduated in Organon of Philosophy from SKHMC Beed, and she has 27 years of experience in classical homeopathy. And she is a passionate homeopath, presented many papers in seminars, and she received many felicitations in different occasions and platforms, and received Lady Legend Award in medical field in 2018, received Ugadi Purashkaram in 2022, received Pride of Homeopathy in 2023. She is life member in IAHP, HMAT, HAMAI, National Journal of Homeopathy. I warmly welcome Dr. Katta Renuka.
Thank you everyone. First of all, good evening, and yesterday is a Doctor's Day. Still, I want to wish all the doctors a happy Doctor's Day. Most of in our day-to-day practice, we think many cases are very easy to treat when you get a PQRS cases. It's very easy. But when you don't get a PQRS type of symptoms, then it becomes a difficult cases. We feel it's not difficult when the case is difficult, but the thought and the approach what we feel makes us difficult. What is difficult? When there is no indicative remedy, or there are so many symptoms but which are not indicating any drug, or it is incurable rare diseases, we feel like it is a difficult cases. So what to do? First, relax. Have self-confidence and also confidence on our system, because our system has got lot of scope for all the kind of difficult cases. Then in any case taking, you need to have a keen observation and perfect analysis. So once you are doing these things, your difficult cases becomes very easy. So here I want to share with few cases how we have to manage the difficult cases. The first case what I want to say is a girl of 2.5 years. She came with epilepsy, with all the typical epilepsy fits. I don't want to mention as everybody knows, but there is no aura for that and no timings. And the only thing is she has all delayed milestones. She cannot walk, she cannot speak, even she cannot move, but she can eat food whenever it is given. She likes spicy food. And whenever she has only convulsions, that time only she has a movement of the typical epilepsy attack. While describing, the father is saying that she'll have a blue lips as if the blood is not passed to the lips. When I see the case, it's really difficult because there is no indicated remedy, nothing. So what to do? I just thought about what father described. I went to the Kent repertory where there's only one and single first grade remedy where it is saying discoloration, bluish lips during convulsions. The only remedy is Naxvamka. But generally I don't want to jump into with one single remedy, which I want to have a supporting symptom, which I call it as cross-check symptom. In the sense it doesn't indicate the drug, but it supports the drug. So when I was looking into the case, the mother said she likes the spicy food. So I happily, with a lot of confidence, I gave the Naxvamika 201 dose, and as expected, within 3 days, there is a duration and attacks and the severity of the case was reduced. So after when I was speaking, after that first prescription, the mother also told about that she also has these attacks more during the head when it's bending backwards. Again, I just check the Kent repertory. That's a not only first grade remedy, not the only single remedy. Again, Naxvamka. So it again confirms your Naxvamka prescription. Then there's another case where it is 8 years boy who came with a prolapse, saying that a mass while passing stool. And nothing else. As usual, no history of family and past is helping us. The only with the frequent diarrhea attacks what he had. and we don't know what to do anything. So again, I just took up the repertory. Prolapse of rectum in children, the only first grade remedy is podophyllum. So though I am not confident, I just, at least this remedy will open up the case, at least. So I gave the podophyllum 200. To my surprise, it not only opened the case, it cured the case. So here I want to say, though we feel it's a difficult case, no, not much symptoms or anything, these small hints will help us to get into the remedy. Then there's a girl of 25 years who came with ulcerative colitis, or nowadays they are calling as infective bowel disease. With all the test reports confirmed, she came to me with the typical symptoms of pain, urge, blood motion and everything. Same symptoms of the disease, nothing particular to our homeopathic prescription. When she was talking about I have pain, nothing can be done and everything, mother was constantly saying that whenever I am cooking, she wants me to shut the door and on the exhaust fan and everything. She irritates always. When I was taking nothing is coming, then I asked the girl, why you want to shut the door of the kitchen and everything. She said, the smell of the food makes me nausea and vomiting, and sometimes on the sight of it also. So happily, as everybody want to jump into the colchicum, but before that, I just want to see her LFT reports and the hemoglobin reports, because that is a common symptom if the reports are abnormal. But as the reports are normal, so I have given the colchicum. Again, here I want to mention, whenever you get a remedy, like a symptom also, you make sure should not be a common symptom of a disease. Like even the cases where we look for this LN case where as a epilepsy, bluish lips, we also have to examine the heart, because there is cyanosis of septal diseases. If it is a bluish lips with a septal disease, you cannot give the remedy, because it becomes a common disease, a common symptom of the disease, not the common symptom of the remedy. So in difficult cases, you have to always differentiate between the common symptom of the disease and the common symptom of remedy. There is a army officer who is of 45 years, diagnosed in his army hospital, sarcoidosis, and they tried all the treatments, and he was lowered his cadre because of the health conditions. He doesn't know anything, so somebody referred, he came to my place. And the ACE also very high, 543, which should be normal of 40. And to just brief you the stages of sarcoidosis, the granuloma in the lymphoma is the first stage, granuloma in the lymph node and the lungs are the second stage. Third stage is granulomas only in the lungs, and he came with the third stage, and of course fourth stage is the fibrosis. So there is nothing much except the common diseases like loss of appetite, persistent dry cough and low grade fever and everything. In the family history, when I was looking for it, there is only asthma and piles. So I have decided to give the tuberculinum basing on the miasmatic history, because in the asthma and the piles is the sorosyphilitic. Here I also want to mention to all the people, it's not only the family history level of miasmatic, you also have to look into the presenting level of the miasmatic also, where it is. If it's in soric level of the presenting complaint, and the family history, if it's a sorosyphilitic, you cannot give a tuberculinum. So make sure that you should have both the levels, miasmatic level should match when you are prescribing it. Then there's a case of a girl who came with a teenage girl with all the acne, as everybody knows, all the pimples, blackheads and everything, no symptoms, nothing, only history is chickenpox. And the face is showing all the kind of eruptions like from papilla to the pustules, which we generally see in the chickenpox disease from the pustules to the, from the papilla to the pustules. So as there is nothing, I have decided to give the variolanum 1M, again thinking that it will open the case, but fortunately it cured the case. Here I want to say it is like a doctrine of signatures. What we use in the remedy, I say doctrine of signature in terms of disease. In the similar way, I also say doctrine of pathology in azoospermia cases where there is a history of mumps, you can go for a parotidium. So always make sure that the chasing of mystery is with the history. So the summary is repertory with single rubrics or basing on the past history or basing on miasmatic, all the difficult cases can be cured very easily. Thank you very much. And here I also want to mention one thing. Though it is a first international seminar for KA, it's not planned, I believe, but it happened that it's all the lady homeopaths are the speakers. I'm glad and I look forward, because in the graduation level we see more ladies but never on the dais. So I thank you for this, to plan it next time to be a lady homeopath international seminar. Thank you very much.
Thank you, Dr. Renuka. It was a wonderful presentation from your side. And now I would like to invite Dr. Kavita Kukunur, CEO and founder of KA Homeopathy Study Group and Kavita Holistic Approach, to introduce the newly published book of Dr. Rajneesh Kumar Sharma, KA Advisor.
Thank you, Dr. Sweta. And it's a great privilege for me to receive Dr. Rajneesh Kumar, our KA advisor, and he is my brother also. This beautiful book, Homeopathy Therapeutics in Universal Medical Terminology by Dr. Rajneesh Kumar, MD. And I got privilege to write foreword. This is a wonderful book, and every homeopath should have this book at their desk. So we are planning to do detailed book review with Dr. Rajneesh Kumar, but in this short period, I would say it has everything a homeopath needs to know. So, if you see each page, it is so detailed and complete information, investigations and the miasmatic state and for what it is used, everything is provided in detail. And thank you so much, Dr. Rajneesh Kumar, for coming up this wonderful book. This is a gift to humanity, and it's a lot of hard work. And this book is available. It's huge. It's like a Bible. This is available on Amazon and also on the Livish website. Thank you all, and we will be doing soon book review with Dr. Rajneesh Kumar. And as vote of thanks, today, thank you once again to all the honorable speakers, and we would honor them with mementos. Thank you so much to all our honorable speakers who presented their valuable presentations at our first International KA Homeopathy Study Group Conference. And we would like Mr. Sai Kishore Kukunur from R2C Innovations and Kavin Kukunur from Kevin Friendly Foundation would like to honor our honorable speakers with mementos.
Thank you very much, Dr. Kavita. Dr. Shweta Singh, we'd like to present you with an appreciation award.
Thank you, Dr. Sweta, for contributions and valuable scientific session in the first KA Homeopathy Study Group International Conference. In the topic, Deciphering the True Realm of Homeopathy.
Big round of applause. Congratulations.
Big round of applause for her.
Next, we'd like to present our next appreciation award to Dr. G. Umarani. Congratulations.
Thank you, Dr. Uma, for the topic, Scope of Homeopathy and Anatomical Care.
Thank you.
Give her a big round of applause.
Congratulations, Dr.
And next, we would like to present an appreciation award to Dr. Renika Kata. Big round of applause, please.
Congratulations, Dr. Renuka.
Thank you.
Congratulations, Dr. Renika, and thank you for presenting the topic, Easy Way in Difficult Cases. Give her a big round of applause.
Our next appreciation award goes to Dr. Fatima. Congratulations.
Your mom is very inspiring to learn. She'll also come up with very nice things in life.
Thank you, Dr. Fatima, and for presenting Scope of Homeopathy in Psychiatric Cases. Give her a big round of applause. And congratulations.
And next, we would like to present an appreciation award to Dr. Vimala. Congratulations, Dr. Vimala.
Congratulations, Dr. Thank you.
Congratulations, Dr. Vimala, and thank you for presenting the topic homeopathy and hypothyroidism.
And now I'd like to present Dr. Shweta Singh to the stage.
I would be appreciating and honoring Dr. Kavita Kunur for her contributions and valuable scientific session in first Ka Homeopathy Study Group International Conference. For her session, Homeopathic Healing with Realm of Imponderables, on behalf of Dr. Rajneesh Kumar Sharma, our Ka advisor.
Big round of applause, please.
Give appreciation to your mom.
Yes, and everyone would please give a round of applause to everyone who's on the stage, and thank you so much. A big round of applause, please.
Thank you so much to our Ka's entire homeopathy study group team for making this event our first international conference grand success, and thank you all once again.
Hi, this is Dr. Umarani Kampa, participated as a speaker on the topic Homeopathy Scoping Antenatal Care in first International Ka Homeopathy Study Group Conference. I felt immense pleasure in participating in the conference as I am a Ka volunteer. It was a great experience for me, and heartful thanks to Dr. Kavita Kukunuru ma'am for giving me a platform to share my knowledge. The conference ambience was nice and all technical support was good. All speakers spent quality time in the evening, and we received the honor in the form of memento and a book written by the Kavita Kukunuru ma'am, Beyond the Limits, and the conference followed by nice musical songs, and our family spent a lot of time with delicious dinner, and we are all enjoyed that night. Thank you so much, Kavita ma'am.
Hi, this is Dr. Shweta from New Delhi, India. I wanted to take a moment to express my heartfelt appreciation for the wonderful party organized by Dr. Kavita and family. It was truly an unforgettable experience, and I'm filled with gratitude for the warm hospitality extended to me. Meeting you and your lovely family was an absolute delight. Every one of you radiates kindness, warmth, and a genuine love for making me feel welcomed. It was evident that you all put a tremendous amount of effort into creating an educational atmosphere through the first International Scientific Conference of Ka Homeopathy Study Group, as well as joyous atmosphere through the party. From the moment I entered your home, I felt like part of your extended family. I enjoyed the delicious food and refreshments served at your home and at the party. It was a pleasure to connect with such wonderful family and friends who share a similar zest for life and a passion for fostering genuine connections. Your dedication to creating a warm and welcoming environment left a lasting impression on me. It is rare to find hosts who are so genuinely attentive, caring, and committed to ensuring their guests' happiness. The memories created during the party will forever hold a special place in my heart, and I am grateful to you for such a beautiful memory. Wishing you all the best and looking forward to our paths crossing again soon. Thank you.